Imagine a world where the deadliest diseases, polio, malaria, HIV, aren't just controlled, but erased from existence. A world where a child's birth in a remote village doesn't mean a gamble with survival. This isn't a distant dream, it's the reality being forged today by a handful of visionary billionaires who've turned their fortunes into a force for global healing. Welcome to Elite Philanthropy, Billionaires Changing Global Health. I'm your host, and today, we're diving into the true stories of these philanthropic titans, their triumphs, their strategies, their controversies, and the future they're building. Buckle up, this is the story of how private wealth is rewriting the rules of human survival. Let's start with the WHO, the architects of this revolution. Bill Gates, the Microsoft mogul turned global health crusader, didn't wake up one day and decide to save the world. In the late 1990s, as he amassed billions, Gates and his then-wife Melinda confronted the stark inequality staring back from their screens, millions dying from preventable diseases while tech boomed in Silicon Valley. Motivated by a profound sense of responsibility, they launched the Bill and Melinda Gates Foundation in 2000, channeling their wealth into eradicating what they called forgotten killers. Fast forward to 2025, and Gates has pledged to dissolve the foundation by 2045 after disbursing nearly $200 billion, aiming to wipe out polio and malaria entirely. Enter Michael Bloomberg, the former New York mayor whose empire was built on data and decisive action. Bloomberg's entry into global health stemmed from his city's frontline battles with tobacco, obesity, and road deaths, crises he tackled as mayor. By 2015, he poured over $1 billion into anti-smoking campaigns worldwide, becoming the WHO's global ambassador for non-communicable diseases. And then there's Priscilla Chan and Mark Zuckerberg, whose Chan Zuckerberg Initiative, CZI, born from their daughter's 2015 birth, vowed to cure all diseases by century's end. As a pediatrician, Chan saw firsthand the gaps in child health. Together, they funneled billions into biohubs and AI-driven diagnostics, blending tech innovation with compassionate intent. These aren't just rich folks writing checks, they're driven by personal reckonings with mortality and inequality, stepping in where governments falter. But this isn't charity as usual, it's philanthropy on steroids, dwarfing traditional aid. The Gates Foundation alone plans to spend $10 billion annually through 2045, outpacing the WHO's entire budget in some years. Bloomberg's Data for Health initiative has equipped over 40 countries, reaching 5 billion people, with vital statistics systems, turning raw data into life-saving policies. CZI's open-source tools, like the CZID platform, now scan terabytes of genomic data in real time to detect outbreaks before they spread. Unlike UN agencies bogged down by bureaucracy, these titans deploy venture capital tactics, rapid prototyping, data analytics, and laser-focused bets. They don't just fund hospitals, they build resilient systems, from AI-powered vaccine trackers to community health worker networks in sub-Saharan Africa. Now, picture the global health battlefield they're charging into. In 2025, 5 million children still die before age 5 from treatable ills like pneumonia and diarrhea, while malaria claims 600,000 lives yearly, mostly kids under 5. Non-communicable diseases like heart conditions and diabetes explode in low-income nations, fueled by urbanization and poor data. Climate change amplifies it all, droughts breeding mosquitoes, floods spreading cholera. Yet, amid this chaos, innovation beckons. mRNA tech from COVID could crack HIV, and gene editing might neuter malaria parasites. These philanthropists aren't waiting for treaties, they're the vanguard, transforming despair into breakthroughs. Take the eradication frontlines, their most gripping success stories. Polio, once paralyzing 350,000 kids annually in 125 countries, now lingers in just 2, Afghanistan and Pakistan, with wild cases down 99.9% since 1988. Gates' $450 million infusion in 2025 alone propelled the next-gen oral polio vaccine, NOPV2, which has shielded 1.6 billion children from outbreaks. Bloomberg chipped in with polio surveillance in Pakistan's volatile borderlands, vaccinating millions door-to-door. Malaria's tale is equally triumphant. Deaths plummeted 57% in 15 years, thanks to Gates-funded bed nets and rapid tests reaching 3.2 billion at-risk people. In 2025, their dual insecticide nets reversed a funding dip, averting 15 million cases. These aren't abstract stats, They're stories of Aisha in Nigeria, who slept safely under a Gates-backed net, or Raj in India, spared paralysis by a Bloomberg-trained vaccinator. Pure, attributable impact. Then there's the tech alchemy. Private dollars turbocharging R&D. Gates bets birth the first malaria vaccine, rolled out in 2021 and saving thousands by 2025, while CZI's biohub network engineers AI models to predict outbreaks from sewage samples. Breakthroughs abound. A long-acting HIV shot, dosed twice yearly for $40, now scaling via Gates' $912 million global fund pledge amid US cuts. Bloomberg's $215 million to resolve slashed heart disease deaths in 50 cities by enforcing simple policies like salt reduction. These aren't ivory tower experiments, they're affordable tools: vaginal microbiome therapies for infections, non-hormonal birth control, trickling down to the world's poorest. Beyond gadgets, they're fortifying the foundations, health systems that endure. In Bangladesh, CZI's pilot with Gates equips labs with genome sequencers to ID mystery fevers instantly, training local clinicians in the process. Bloomberg's vision screenings in Nigeria distribute glasses to millions, while Gates funds 70 million lives saved via the Global Fund since 2002, training midwives, stocking rural clinics, and weaving digital ledgers to track supplies. In war-torn Yemen or flood-ravaged Malawi, these initiatives build anti-fragile networks, resilient to pandemics or politics. What gives them this edge? Strategy, pure and simple. Data-driven to the core, Gates deploys analytics like a chess grandmaster, evaluating every dollar's ROI to pivot fast, unlike aid orgs mired in red tape. They're catalytic. Bloomberg's tobacco controls de-risk WHO policies, pulling in billions more. CZI's open source code invites global coders to co-build. Agility shines in crises. Gates surged for $0.9 billion to the Global Fund during COVID, while Zuckerberg's tools flagged variants weeks earlier. They fund the unfundable, gene drives against mosquitoes, AI for maternal preeclampsia, ideas too risky for bureaucrats. Yet, no revolution is flawless. Shadows lurk in the glow. Critics decry the savior complex, Gates Foundation, rivaling WHO's sway, accused of top-down agendas that sideline local voices, like over-focusing on vaccines over sanitation in India. Bloomberg's data pushes, while transformative, raise privacy fears in fragile states. CZI's DEI funding cuts in 2025 sparked backlash for abandoning equity commitments. Sustainability haunts. What happens when Gates shutters in 2045? Initiatives reliant on one man's wallet risk collapse without handover plans. Unintended ripples? Massive polio hunts in Pakistan distorted local health budgets. Breeding dependencies. Tobacco wins flooded markets with e-cigs, a new vice. These critiques aren't dismissal, they're calls for humility, demanding philanthropists amplify, not eclipse, the communities they serve. As we peer ahead, elite philanthropy evolves. Impact investing surges. Gates' $2.5 billion women's health R&D pot through 2030 targets preeclampsia cures and menstrual tech, blending profit with purpose. Collaboratives bloom. Wellcome Leap and Pivotal's $100 million for autoimmune breakthroughs in 2025. Local empowerment rises. Bloomberg City Networks hand reins to mayors in Lagos or Bogota. Beyond Billionaires, the tide turns collective. Smaller foundations, crowd-funded vaccine drives, citizen apps tracking outbreaks. The Giving Pledge now boasts 240 signatories, democratizing giving. This is our cue. The story's not theirs alone. Whether it's $5 to a microdonation app or volunteering at a clinic, your spark joins the fire. Global health thrives on diverse hands, not solo saviors. The titans have lit the path, now we walk it together. Eradicate, innovate, empower. The end of disease starts with us. If this tale of transformation inspired you, hit that subscribe button for more deep dives into the forces shaping our world. Like, share, and comment. Who's your philanthropy hero? Until next time, stay curious, stay compassionate.